We're live. Hello, everybody. My name is Kevin Purcell. We're here today to talk about Movember and all things men's mental health and physical health. We're waiting for our guest to arrive. It's EPP Group MEP Tomas Tobé from Sweden, so we'll keep an eye out for him. Before we do that, I suppose we'll talk about Movember and what it actually is. It's essentially a global campaign aimed at raising awareness about, as I said, men's health issues, both physical. I can just see Thomas has joined us there, I think. And there he is.
Good evening.
Good evening. How are you?
I am fine, thank you. I just ended another meeting with the Development Committee in the European Parliament. It's been a meeting all day.
Okay, and are you in Brussels or Sweden?
I'm currently in Sweden, outside Stockholm, due to the pandemic, but hopefully I can be back in Brussels soon.
And how is everything in Sweden? I know there was some concern about cases of coronavirus there. Is everyone doing okay?
Yes, I would say that in Sweden we can see that numbers are unfortunately going up, as we have seen in many member states, and of course the restrictions are getting harder, and hopefully we can try to see the numbers going down again. But I think it's really important now for everybody to really follow the recommendation and try to give especially the healthcare the opportunity to cope in this situation, and we can all do our part and try not to be too close to other people.
Absolutely. We're here to talk about Movember. I was just explaining before you arrived, for people who don't know what Movember is, it's basically a global awareness campaign. I'm not sure how familiar you are with this or how popular it is in Sweden.
Well, I would say it's quite popular in Sweden. Of course, the campaigns concerning breast cancer is, of course, has gotten a lot of attention, but this is getting more and more attention, I would say, also in Sweden, and mainly because cancer is unfortunately such a big problem. There are so many people that get affected, and we don't detect it early enough to save lives. And I think these kind of campaigns are really important because we can actually do something. Of course, we want the research to go forward, and we want to do our best to beat cancer, but we can actually do more together as well.
And obviously Movember is targeted at men who might be a little unwilling to go to the doctor to get checked, and it's all about raising awareness for things like prostate cancer, which is a serious problem in Europe. Screening is very important when it comes to that.
Yes, I fully agree, and unfortunately we don't see any fully scale programs when it comes to men's screening. And it's quite clear if we try to learn example from mammography, what we can see with breast cancer, we can see that we can detect half of them through screening. But of course, this is something that I do hope that we can see more of in the future, because I think it's really also important to take away what I guess, I don't know, but I guess that many men don't really are open to go for the screening themselves. They're waiting too long, and perhaps the problems are too severe when you actually go and have it checked up. So hopefully if we can have really good programs instead, we could detect more early cases, and then we can save lives.
And try and get men to open up more and talk about their problems as well, and if they're feeling there's something wrong in their body, to get it checked out.
Yeah, absolutely. There are many that basically say that it feels a bit unmanly to do it, and I think we just have to learn from the experience that we have also on this matter, and this is a question that we need to take up on the table. And everybody, of course, nobody wishes that you will get a bad result, but it's better to get a bad result early on, because then you will have a better chance. And of course, we need to make sure that we also now invest more in in research. I think it's also important between the member states that we can have a best practice and try to share all that we know about it.
And of course, ongoing work in the BECA committee, the cancer committee in the European Parliament, and work in the Commission as well to really try to tackle cancer.
Yeah, and I mean, this has been an initiative from our political group for a long time, and also our chairman Manfred Weber has been personally very engaged in this question. And I'm really glad to see now, because of course we don't want this to be a party political question. We just think that this is a question that needs more political attention, and I'm really glad to see now that we have also gotten support very widely in the European Parliament, and then we now have a committee working on this. But I also think that I mean, we as MEPs or whatever your role are, I really think that we need to talk about this and try to do our best together.
And also, you know, lifestyle factors play a part, and we're speaking to you because I think we had a look at your Instagram and you put us all to shame with your exercise routines. Was fitness something that you've been into for much of your life?
No, not really. I mean, of course, when I was younger, I played football and I was a referee in ice hockey and so on. But for many years, I did not train a lot, but I kind of felt it was actually, to be honest, it was actually before the election campaign to the European Parliament, when I kind of felt like I don't feel at my top game, and I decided then that I really wanted to try to have more physical training, and I started with CrossFit. And for me, that has worked really well because not only am I feeling better physically, it's also very good, I would say, for the mental health. I mean, you are much more awake and you actually deliver more, I would say, at meetings and with family and with your kids or whatever is important for you. So I really recommend that you try to find something that you like. And CrossFit it's really I would say addictive. It almost is something that you it's almost like you go into some kind of cult or something. You eat many times and you train a lot, and you don't talk about anything else than CrossFit. Finally,
I suppose it's a healthy body, healthy mind. Is it something you do, you know, regularly, once a week, twice a week? How does it work for you?
Well, if I'm totally honest, and of course I need to be honest. I mean, I train CrossFit a lot. I train 6 days a week, so I do it a lot. But I mean, I didn't start that way. I think I started with like 1-2 times a week, and that is fine too. You know, this is not about the numbers. I mean, for me, it's important. I think I always try to find a way. I mean. In history, I would say I always had a good argument for not go training. And for me, I don't like go do exercise for myself. What I like with CrossFit is that I do it together with others. There are some competition, but there's also respect for each other. And for me, that kind of energy works. But I really think that everybody needs to understand that if you go and train and whatever you like, it is an investment in yourself. So it's something that you just have to put and try to find in your life. And I understand it's hard. I have small children myself. I have a hectic job. But you can always find some time during the day when you can do this. And when you do it, I can promise you that you will deliver better in all the aspects of life.
Well, that's my problem, is trying to motivate myself to get out and go to the gym. And now that we're in lockdown here in Belgium, it's difficult. I've got 2 dumbbells and a mat, and that's it. And it's in the office I work in. So it's very hard for me to actually, you know, sit myself down and get on and do it.
Yes, I mean, I fully understand that. And this lockdown is, in that sense, perhaps a bit terrible. But I mean, you can always do things. I can tell you that... I mean, I'm Swedish, and the politicians, the MEPs that are elected, and also our staff, we have like this stepping contest going on right now between each other. I mean, it's just silly, but it's also, in a way, it forces us all in a way just to go out and have a walk and try to be out. And if you have that opportunity, even if you're in a lockdown, that could be one solution. If you just go for a short run, but I mean, whatever you do, I mean, I do know people also that perhaps their training is 10 minutes every day, and those 10 minutes are better than 0 minutes a day. And that will give you energy, and that will make you more healthy. That's just how it is. And yes, there are days where I don't feel motivated either to go to the gym. But those, of course, and you can take a day off or something. But most of the times, just drag yourself there, and then everything will be fine.
And another aspect, as we talked about, it's not just physical health that this whole Movember campaign is about. Mental health is important too, and particularly during COVID and during lockdown, when men are in their homes, maybe not out talking to their friends as they would before. It can be difficult for them, and they might not be comfortable about talking about how difficult it is.
Yes, absolutely. I think, I mean, we already see that we have a lot of problems with mental health during this pandemic. And I think in every way we need to help each other, especially give a call to people that we know perhaps are lonely, but also just for ourselves, really try to think about it, because of course it's not easy. This is in a way dramatically changing our lives, but of course the thing with, if you can have the opportunity to also train, that is really a good investment in your mental health. And the studies are there. It's not a lot of things that can beat it. Of course, a good sleep could help you as well, but if you train, then you will sleep well as well. So yes, I mean, I don't want to give a picture that the only thing I think of every day is training, but I think just to take it as one part of your life, I can really recommend.
And the other things will follow, hopefully, if you maybe have a workout and your body starts to feel good, your mind starts to feel good as well. But important as well to talk to people if you're feeling down.
Absolutely, absolutely. I mean, I think we also should. I mean, there are a lot of things happening now with many people getting sick. We have lost too many lives already, and we know that we have some hard weeks and months coming as well. But there are also light in the tunnel. We can see that we have vaccines that seem to be. I mean, we have some signs that might be hopeful. And I mean, some days we will have the vaccines ready for people, and then we can get more into a normal life again. I mean, it's coming. It's hard now. We have to stick it through. And I mean, it's also the same thing with cancer. I mean, cancer is terrible. It's a terrible disease that has caused so many problems in society. But we also know that we are making improvement. The research is going forward. We get better at different methods. We try to detect it earlier on, and we can actually save lives and make sure that people can live their lives with their families. So I mean, there's always light in the dark tunnel as well.
And just to go back to that, before I do, I'll just say to our audience, they're free to write any questions they might have for you. We do have some pre-prepared, which I'll get to in a minute. But going back to the cancer issue itself, because you know, I want to talk about how important Movember is in raising funds and raising awareness. And just some of the stats are pretty stark. I mean, the impact of prostate and testicular cancer on lives is substantial, with prostate cancer the second most common cancer in men worldwide. And the number of cases expected to double to 1.7 million by 2030. That's just 9 years away. Hopefully, with the work that you guys are doing in the Parliament, that these figures can start to come down, that a real plan to address this can be put in place, and more of a coordinated action across member states to deal with it.
Yeah. I mean, I fully agree, and we have to do whatever we can, I would say. And I think it's interesting that for me in Sweden, this is not part of the political debate in Sweden, in national politics, for example. That's why I think it was really interesting when Manfred Weber and our party group presented this initiative at European level. What you actually see now is this is spreading now. You can see that more and more political parties and politicians also at national level are taking on this question, and I think that's basically what we do. This is not only a question of funding the research as politicians. I really think that we need to put ourselves in the leadership. This is something that we need to combat, you know. And now, of course, we do know that we might not end up with taking away cancer, but we could at least try to go to the level where we can live a longer life and a better life, even if you get the disease.
And do you think because of the pandemic that we're more health conscious? Really, we see what can happen. Health is going to be a focus. I know from the EU for Health program and that kind of thing, that people are really starting to take health much more seriously, given what's happened over the last 9 months.
Yeah, I mean, I think that is quite clear. I mean, we have to learn more from each other. There are some areas where we actually need to be working more also at European level. I mean, of course, when it comes to the healthcare, of course, I mean, that's the responsibility of sometimes the national states or the local councils and local regions and so on. But it's quite clear when we have this huge pandemic, it doesn't care about our national borders. That might be important for politicians or citizens. It doesn't care about that. And it's clear that we are so interlinked to each other. So, of course, politically speaking, we need to focus more on this. I think that's just quite clear. And I think also people, but if during these times, what people start to think about those kind of things as your own health. I mean, what kind of food am I buying? Am I training? How is the situation with the people that I care about? I think these kind of issues, of course, get more important because now we're really kind of in a dark time in a way when you start thinking about these things. You know.
Yeah, well, I think we're all going to be health conscious, and once this is over, and maybe we'll all be doing CrossFit with you. Speaking of which, we'll get to the questions. One just came in there that I wanted to ask you first, and that is, what is your favorite CrossFit workout? I don't know what the difference is, but maybe you can explain.
I don't know. It's very okay. I would say it's very hard. Perhaps snatch. It's called. I know. I mean, it's very hard to explain. Basically, you lift heavy weight over your head, basically, and that is the challenge. You have to take it from the floor, get it over your head, and you have to do it in a very specific way to make it look good. And that is a really fun exercise. But I mean, in general, for me, it's not about the certain exercise. For me, with CrossFit, it is that everybody is welcome. It doesn't. Nobody cares if you have been training a lot or nothing. You always kind of work from your own where you are, basically. But everybody is in a way creating a lot of positive energy and making sure that you will do your very, very best when you're training. You will not get away, because that's what happened. At least for me, if I go and train for myself at the gym, of course, I would try to do my best. But it's also very easy to kind of feel, well, I'm done now. You know, this is getting heavy. I'm done now. I want to go to the shower. I want to go home. I want to see Netflix instead. You know. But if you do CrossFit, it's a very set session, and you will deliver during that session. and it's not that long either. But the kind of things that you do together, and it's very of things. So there are some things that might be easy for you. One thing could be just running or being on a bicycle or something like that. And some things are more complex, and then you have to learn.
Very good. On a serious note, another question. Someone wants to know what are the plans for a prostate cancer prevention program or cancer prevention program for men? I know there are things in my home country in Ireland like breast check for women, which is quite prominent. Do you think there should be something like that for men?
Me personally, I think yes, but that is not what we see. We don't see big political initiative going in this direction. I understand that. I mean, the methods is still discussed. Would it be effective enough? That is of course a discussion that you will have to have with the scientists and doctors, and of course governments that are basically funding the screening programs. But from what I have learned, I think that this is the direction that we need to go to. I mean, I think it is. I mean, I remember when they started with the screening for breast cancer. It always have to start somewhere, and of course, if you start out with more of screening, and you might learn even more things when you can do it on a larger scale, then perhaps we can also learn, how we can modify it, how we can change it. But for me, it's quite clear with the numbers that we are seeing now, that it's clear that we need to do more, and we do know that if we can be preventive, we can do a lot. I mean, I see numbers that we could actually avoid in general with cancer. Numbers up to 40% of the cancer we can avoid if we take preventive measures, and that for me is at least a political signal that okay, then we have to do more preventive measures, because of course there will be we need to fund it, and we need to find the best way to do it. But the cost is there now already. Of course, economically speaking, when people get cancer, but more worstly, that people are dying from this terrible disease. So I think the work is there for us to work with, as EPP and as politician, and I would say as citizens of the society as well.
A few more quick questions before I let you go. Someone asks, why isn't there a worldwide organization like Pink Ribbon for Men? Pink Ribbon is the breast cancer awareness campaign. I suppose Movember is sort of the equivalent, I think, for men. It's 1 month, and it's a big awareness, and people grow mustaches and all sorts of things. But maybe the point is there isn't as much awareness for men's cancer compared to women, possibly.
No, that is the case, but I mean, what we see with this campaign is more and more people wearing the mustache. I don't know if you have that in many countries, but that's what I see in Sweden. I see that some men also try to grow a mustache during the month. I'm not doing it myself on the sake of that I will not be able to do it in a proper way. So not be good looking. That's just how it is. But I think we are still early in this discussion. I think that's mainly the reason why we don't talk about this more.
Two questions about, I suppose, mental health. Someone asks, how can we better manage the stress of being constantly alert? Someone like you, maybe as an MEP, I'd imagine your phone is hopping all the time with emails and messages. Do you do anything to switch off from that to give your mind some rest?
Yeah, I think that is really important to try to find ways to do that. For me, training is one way to do it. I mean, I will be logged out from the society, and it feels a bit scary sometimes, but actually the world keeps spinning even if you are away for 1 hour. And you just have to find those things, and perhaps it depends on how your life is. But for me personally, I always try to to have my Sundays as free as possible for private life, being with my family, with my children, not being connected to the cell phone that much, because you need that also to kind of, me personally, I think that you reflect also better when it comes to your work. If you kind of try to find this way when you kind of don't think about work or not constantly looking at your text that you're receiving or your emails that you're receiving. Because I think all of us, we have the email in our phone, and it's so easy to kind of look at job emails late at night, and then you start thinking about it when you're going to sleep and so on. So I really think, a smart way is to not do that, basically. And if you have a smart boss, you will not have a problem either, because a smart boss understands that people also need a private life. You cannot work all the time. And now I think all the people that will work with me now will remind me of what I'm saying.
Important as well when you're working from home and people think you're available 24/7, but that's a different issue. Another question as well, what's a good way to support your male friends if they're struggling with something mental health wise?
Excuse me,
how do you support a friend, a male who might be struggling?
No, I mean, I think the best thing that you can do is, of course, that you have to. I don't think that you should be so afraid to actually give a call and reach out. Sometimes that could be hard. I understand it. It's easier to kind of think, no, I don't need to think about this. So I think it's much better if you try to reach out, and perhaps you reach out and you might be wrong, but that's not a huge problem, I would say. Try to reach out, also try to listen. What is important, and try to listen. I mean, people have different feelings. People might have a different approach also during this time with the pandemic. I mean, sometimes you will have to find a way to have a laugh and try not to be so serious all the time. But you also have to respect that people have different feelings during these times. And I think that trying to listen to each other, you can really achieve a lot. And sometimes people just need to talk, to go forward.
Okay, and before I let you go, just one more on the lighter side of things. Someone wants to know, do you practice any sports? Do you do anything apart from CrossFit sports-wise? Any particular game you're interested in?
Well, I try to do some running, but otherwise than that, no. I used to play football when I was younger, but days I focus on CrossFit, but I'm open. I understand that there are many things that people find that really get them engaged. So I'm open. So if you have any suggestions, just send me an email or reach out to me, and I will have a look at it.
And we eagerly await what you'll end up doing following that call. Listen, we'll leave it there. Thanks so much for taking the time this evening to talk to us on an important issue, and stay safe.
Yeah, thank you. Stay safe and stay healthy.
Take care. Bye-bye.
Okay, bye-bye.
Thanks. Bye-bye.